Hello and good evening, everyone. Welcome to Body Contouring 101. I am Jazz Esterninos, and I'll be your host for this online event where we will discuss anything and everything about body contouring. Well, of course, joining me live tonight is one of the leading plastic surgeons in the country, a diplomat of the Philippine Board of Plastic Surgery, and a fellow of the Philippine Association of Plastic Reconstructive and Aesthetic Surgeons. From the Institute of Plastic Surgery, no other than Dr. Lutgardo June Caparas Jr., or better known as Doc June. Hi, Doc!
Hi, Jess.
Hello!
Hi.
Yes. Tonight, we get to answer all of their questions about body contouring operations, such as breast augmentation, liposuction, rhinoplasty, and many more. Very interesting topics, di ba, Doc? So, syempre, guys, to all our viewers tonight, no, to all those who are watching from the comforts of their homes, sa mga kakauwi lang at mga nag-open ng kanilang Facebook account, our priority tonight is to answer your questions. So go ahead and type them in on the comment section and I will ask them to Doc June. All right, to get started, just in case we have viewers out there, no, who are not so familiar with body contouring, a very, very interesting topic. Can you give us, Doc, a brief explanation about body contouring?
Actually, after weight loss coming from diet, coming from post-bariatric surgery, coming from pregnancy, there would be loose skins. Okay, so body contouring procedures tend to address this loose skin. It would remove the excess skin and tissue, or it can also fine-tune what the existing skin types. So it's a general term for these kinds of procedures, and under this would be a lot of procedures. I can cite some: liposuction, breast augmentation, breast aesthetic surgeries, which it would include augmentation, a breast lift, breast reduction. Then there would be your tummy tucks or abdominoplasty, and all the lifts, thigh lift, arm lift, or your brachioplasty. And for big ones, there's such a procedure known as panniculectomy. So these are the different procedures that would be bundled into the body contouring procedures.
Ayun. So
Basically, the
contouring.
end result would be fine-tuning of the skin, the damaged skin and tissue excess.
For our first question, how does body contouring differ from liposuction? Are they safe or painless? Yes, Doc.
As I've said earlier, liposuction would be one of the procedures that would fall under the general category of body contouring. Okay, so when you do liposuction, you contour the body, you contour the shape that the patient would want. Now, as to the question, it's safe. Definitely, it's very safe, done by trained and qualified plastic surgeon or any aesthetic surgeons. And is it painful? Normally, I do this, depends on the area. If it's a small area, I can do this under local tumescent anesthesia. But then if it's a big area, I usually do this under sedation. Okay? The patient will be sleeping. So it's painless during the procedure. Recovery-wise, probably the first 3 days is sore. If you're going to grade it, it would be probably around 4 out of 10. 10 is the most painful. This would be around 3 or 4. The only pain that you would feel during the liposuction would be on change of position and when we touch the liposuction area. I think that's how it is in terms of pain.
Okay. Ay, so as mentioned by Doc kanina, no, there will be painful feeling pa rin, but it depends on the part kung alin yung na liposuction.
And let me expound more on liposuction. Some patients would want immediate result. No, that's not the way. They will go to the process of healing. First, there would be swelling the first 5-7 days. 50% the desired shape and size would be seen only after the first month, and the remaining 50% probably after the third month. So there would it would go to that process. Hindi immediate, hindi magic. But then you can see already the result immediately. But then it would still, the cell would still subside down. And this will be much better after the third month.
Yes, it goes on a process. So thank you,
Yes,
Doc, for answering that first question. So first question pa lang tayo. And now we have here, what is the benefit of body contouring?
Well, as I've said earlier, it would fine-tune the shape of a person. Like, for example, normally it's done after what we call as a weight loss, okay? Massive weight loss. So you're going to remove the skin excess together with the tissue beneath it. So to contour as I've said, the body, but then in it would be a lot of procedures. So it depends on the need of the patient. So when you say body contouring, it would entail a lot of procedures, okay? It would also be tailored to what the patient needs.
Yes, tailored into what the patients need. So, kanina no, there are many benefits mentioned about body contouring, most especially about fine-tuning our skin. And now, here is the question. Sabi nga, can I use my own fat to enlarge my breast, but in other parts that I want to look thicker?
Oh yes, that's what we call as fat transfer. Before, the problem with fat transfer now, we talk first with the breast. Yeah, you can put in fat into the breast, okay? Shape it, but then the problem with fat transfer, fat grafting to one area, especially on the breast, is number one, the shape and the size will vary because 40 to 50% of the fat that's injected there will be absorbed after some time. So it will go small, okay? Number two, especially on the breast, there's such a thing as mammogram. All women knows about this.
Mm-hmm.
If the patient's mammographer is not really good, they might detect the injected fat because when you inject fat, when it heals, there would be calcifications. So it might be detected in the mammogram as a possible sign of cancer. It might be BIRADS4, they consider BIRADS4 which is suspicious of cancer. I have that probably on 2 of my patients. I have that bad experience. I fat grafted an area that was depressed after a lump was removed. And then I had it checked initially by MRI, and MRI would say it's okay. But then she had a mammogram 6 months after, and the mammographer signed it off as BIRADS4, suspicious of cancer. So the patient was alarmed, but then I was not alarmed, but because I know that's the fat that was injected there. That's the problem with that. So there would be 2 possibilities. Number one, the fat that would be injected would not stay there long. There would be about 40 to 50% reabsorption rate, plus the possibility of calcifications that will probably make some problems in the diagnosis. As to the fat, I used to do BBL before. Fat transfer to the fat is termed as Brazilian butt lift, BBL. I used to do that before, not many, because I'd rather put in an implant. The problem with BBL now is the risk. If you're going to Google it, there would be some articles that would say it's the deadliest aesthetic procedure. Actually, in some series, the mortality rate is 1 in 3,000 procedures. So that's a little bit high. So I stopped doing it. I'd rather stop implant, putting an implant to the fat rather than have that possibility. So there would be some surgeons or probably a lot of them would be doing this, but then there's that possible risk. I used to do that, as I said, I used to do that before, but then I stopped. When I attend conferences abroad, which I usually do 2 or 3 times a year, that's one of the precautions they discuss.
Okay, Doc. So, like, you prefer putting
I'd rather put in an
no?
implant. Yes, I would rather put in implant.
So that would be like safer, kumbaga.
For me, the patient doesn't want it anymore, you can always remove them fast.
All right. That's very insightful, ano? And